Hello, everyone. Well, we are going to be talking about menstruation cycle and the PCOS as well with a naturopathic doctor. She is in our studio today, Dr. Danielle. Welcome, Dr. Danielle. Dr. Danielle actually specializes in PCOS, fertility related issues, menstruation, and she is a naturopathic doctor. So,
Yeah,
thank you. Welcome, Dr. Danielle.
thank you for having me.
Sure. So let's just talk about, like I remember, my grandmother and my mom, there was no issues at that time on menstruation, PCOS, fertility, all those things, right? So now there's so much surge in younger women on all these issues, right?
Yeah.
So what are your thoughts on that?
Yeah, I mean, I think we definitely live in a more toxic and stressful world. If we look at our, self-care products, our makeup, our skincare, our shampoo, there's, many chemicals in there that can disrupt hormones. We also live a faster paced lifestyle. I think that your mom and grandmother probably ate more whole foods where we have access to fast food in every corner. So I don't think it's one particular thing. I think it's all these things layered together that have kind of just made almost like a hormone storm for us and made it really difficult to have balance unless we're really paying attention to it.
Sure. And you specialize specifically on PCOS and menstruation. They're obviously correlated. And what happens in PCOS? So let's just talk a little bit as far as the menstruation is concerned.
Yeah, so PCOS is a complicated disorder. It's the most common endocrine disorder in reproductive age women. Symptoms often present in the teen years. So teenagers will have periods, really far apart, more than 35 days apart. They might have, 9 cycles in a year. They may be really heavy, really painful. So oftentimes teenagers are being prescribed the pill to manage these menstrual symptoms without any discussion being held around what these symptoms really mean and what a normal cycle should be. So I see a lot of women who are in their early to mid 30s, getting off the pill for the first time since they were a teen, hoping to become pregnant, and are just now learning about this PCOS diagnosis and are having to do all of this work to support their hormones and support the underlying cause of their PCOS, which is often insulin resistance, so an imbalance with blood sugar. And they're having to do all this work before they're even able to get pregnant because oftentimes women with PCOS don't ovulate, so they're not releasing an egg from the ovary each month, and that's what causes the irregular cycles. And of course, without ovulation, without an egg there, pregnancy can't take place. So it's really, can be really upsetting for women who are ready to start their family and then they learn that they have this condition. And it's really something that they could have been treating all along had they known.
So that's alarming, right? So a 16-year-old girl or a 15, 14, 15-year-old girl has been on birth control pills for like almost 15 years. And
Yeah.
now you have to take all this toxic load that has gone into that body. And now how you start unraveling, peeling the onion one by one and making them kind of being normal. I mean, that is must have been very difficult.
Yeah. There's a lot of layers to it. We look at reducing inflammation, supporting gut health, supporting stress management. Naturopathic medicine really does shine when it comes to PCOS treatment because it looks at the whole person, it looks at lifestyle. PCOS typically doesn't go away. It's not like you can't prescribe a pill and then it disappears. So it's really learning about how to eat and live in a way that's going to manage your symptoms long term.
I see. So what are the tools that you use for PCOS now that you've got this 15-year-old, 15 years of, I should say, that toxic load that comes to you. Now you got to clean it up, right?
Yeah.
So how does that work?
Yeah. So, well, when it comes to the pill, we definitely look at supporting liver health, and supporting gut health. Those are the top two. And then when it comes to PCOS, so 70% of women with PCOS have insulin resistance. So that puts them at risk for developing diabetes. So we really look at how can we eat to maintain a stable blood sugar. And then there are certain supplements and herbs that you can take as well to help support insulin and blood sugar. So that's definitely a key piece. And then the other piece of it is that women with PCOS often have high androgen hormones, which are hormones that include things like testosterone and DHEA. And these hormones cause classic PCOS symptoms like acne, facial hair growth, and hair loss. So working to improve hormone balance, again, through those natural therapies, herbs, supplements, diet is really important to help manage those symptoms that can be really disruptive to women because they're so visual. And, you know, especially with the facial hair and the acne, that can be really hard on someone's self-esteem. And is another reason why teens might be prescribed the pill is for the acne piece. So another reason to, you know, question if your teen is being prescribed the pill, say why, you know, why are these symptoms happening? Because it's common, but it's not normal.
So, and then, I mean, weight gain is another one, right? I mean, at least most of the teenagers, that not that I've seen many of them, but the research that I've read, a lot of them also tend to put on a lot of weight as part of the facial hair growth and the acne and all, right?
Yep. Yeah. So weight gain is definitely a symptom of PCOS. You can have PCOS and be, you know, a healthy weight, a regular weight. You don't have to be overweight to have PCOS, but it is very common. And yes, it's partially due to the blood sugar imbalance. We can also see an imbalance in cortisol, which is our stress hormone, and that can contribute to weight gain. And with women with PCOS, it's not as simple as eat less, exercise more. I mean, I see women who kill themselves in the gym and they're like, I do not lose a pound. It's really about, you know, reducing inflammation in the body, supporting hormones, looking at thyroid function. That's something that can be off with PCOS as well. I think women with PCOS are often, you know, shamed in a way because of their weight, and they're made to feel like they're not trying hard enough when they're trying almost too hard. You know, sometimes over exercising can actually be hurting their case, but they don't know that. They're just trying whatever they can to try to lose the weight.
Okay, so now let's just talk about, as a naturopathic doctor, what is the starting point, in the sense like you're going to take some lab tests with them and try to understand, you know, inflammation in the gut or, you know, thyroid issues. It's all interrelated, right? That's what we're talking about. So what is the first step? And then you use tools of diet, obviously herbs. So just walk us through this whole step process.
Yeah, so if somebody comes to me and they don't know if they have PCOS, the PCOS diagnosis requires two of the following three things. So the first is going to be a regular cycle. So again, those periods more than 35 days apart. The second is going to be signs of high androgen hormones. And we can see this on blood work, or we can see it on those symptoms like acne and facial hair. You can have one or the other. And then the third is going to be polycystic ovaries. So essentially this is when the follicles in the ovary don't quite mature. And you can see this on ultrasound. So typically your gynecologist will run this test. Depending on what state you're in, your naturopath might be able to do it as well. So that's kind of how you diagnose it. And then from there, lab work, looking at a full hormone panel. So I like to use the Dutch panel, which is a dried urine test. It looks at our sex hormones like estrogen, progesterone, and testosterone, as well as our stress hormone cortisol. And then also looking at things like a thyroid panel, looking at inflammatory markers like CRP, and then looking at vitamin deficiencies. So vitamin D, B12, iron, all those things. So really getting a full picture right from the beginning. So, you know, typically it's not going to be one lab is off. We're usually going to see many things off. So we want to get a really clear picture from the beginning so we know what direction to head with the treatment.
Okay, and then you're using diet, herbs, and what are the tools that you're using to help make sure that they start ovulating, you know, within the time frame that they need to?
Yeah, so with diet, looking at what foods are inflammatory to them. When it comes to PCOS, there's like a big debate out there if gluten and dairy should be completely eliminated or if they can be part of a healthy PCOS diet. My stance is that there is no one single food that has to be entirely eliminated, but it is important to look at what foods are causing inflammation to that person. And those are going to be different foods for everyone. So we look at that. We also look at how to eat to stabilize your blood sugar. So I always encourage a fiber, a healthy fat, and a protein with every meal. And then moving on from there, looking at if there are any nutritional deficiencies, we might supplement with vitamin D or iron. And then there are certain supplements that can support the hormones and the ovulation. So the top supplement I love for ovulation is going to be myo-inositol and D-chiroinositol. And people know that typically as Ovasitol, which is a company that has combined those two. That can be really helpful with supporting blood sugar and getting a woman ovulating. When it comes to the hormone piece, there are many herbs that can help support androgens, things like saw palmetto and nettles can be really great. There's so many tools in our toolbox, so it's really finding what works for the person. And then from there, looking at, stress management is going to be a huge piece. So looking at how can we incorporate that into their day, looking at how they're sleeping, looking at how they're exercising. So a lot of women with PCOS will overdo it and do a lot of cardio in the gym, but strength training has been found to be best for PCOS because it helps you build the muscle, which is lean mass, it increases your metabolism, and it helps you helps improve insulin resistance as well. So just kind of looking at all those pieces together. And the goal is to not have to be on a million supplements forever, but really getting your body to a place where it's well balanced, inflammation is low, and then hopefully over time, cutting back on the number of supplements you have to be on.
Sure. And how much time does it take? Like, let's say a client walks in and she has not been ovulating, and how much time this whole treatment, the protocol would take, like 3-4 months, or what does it take for them to start ovulating again as normal?
Yeah, it's really individual. I mean, I've seen women ovulate as quickly as 2 months. I've seen women take, 9, 10, 11 months. It really depends on kind of their health going into it. If they've been on the pill, how long they've been on the pill in the past, what their driving cause of PCOS is. For some people, it's not the insulin resistance. Some people, it's related to their adrenals or related to, chronic inflammation in the gut. So it really depends on what we're treating as the root cause. Typically, it takes about 3 months to really start to see an improvement in hormones, regardless of what the hormonal balance is. So I always like to tell patients that, like, be really patient for the first 3 months. Know that even if you're not seeing these big changes are happening. So I would say like 3 to 6 months is typically where people start to oops, sorry about that. 3 to 6 months is typically where people start to see, good improvement and start to get a really good understanding of their symptoms and what they have to do to manage them.
Sure. Any comments anyone has? Someone made a comment, says, you mean menstruation? I thought menstruation and mensuration can be used interchangeably. Correct me if I'm wrong. Maybe I did not say it right.
I think you're pronouncing it correctly.
Yeah. Okay. All right. Well, thank you for the comment. Anything else you'd like to add before we wrap up? I think this is a lot of hope that, what we're doing is giving hope to all the young women or the, in their 30s who have PCOS, and natural therapies can help you, right? That is the intention why we have Dr. Danielle, who has been helping so many women along her career to get, have a normal cycle.
Yeah, and I think that a lot of times women with PCOS are told, take this pill and come back when you want to get pregnant. And I think it's important to note that PCOS is not just a fertility issue. For one, it's never too early to start working on your fertility health. If that's your goal down the line, I say don't wait, work on it now. But also, even if you don't plan on becoming pregnant, unmanaged PCOS can increase your risk for diabetes, of heart disease, of depression, anxiety, even eating disorders. So it's really important to, start addressing it now and not wait, because it's not just about coming back when you want to get pregnant. It's about so much more than that. And I also want women to know that there are other options besides just taking a pill. And I think a lot of women out there are desperate, searching for answers, but there are doctors out there who do want to help you and do want to support you and have other tools to do that. I do have a 12-week group PCOS coaching course, which is going to be launching at the beginning of May. And that is a 12-week course that's going to walk you through the framework I use with my one-on-one clients, and really provide you the tools that you need to get in control of your PCOS naturally.
Well, thank you so much, Dr. Danielle, for educating us about how natural therapies can help overcome PCOS. And don't ignore these. I mean, we're not trying to propagate don't take medication here, but what we are trying to say is that natural therapies like naturopathic doctors here, or some of the other therapies that we talk about, Ayurveda, acupuncture, all of these natural therapies, embrace them and they will help you overcome PCOS, at least in a manageable way. So that's kind of what we are trying to say here.
Yeah, exactly. Yeah, and I think that if the conventional route and the pharmaceuticals do work for you, then great. But I know a lot of women, it doesn't work, and I just want them to know that there are other options.
Yeah, absolutely. Thank you so much, Dr. Danielle. And we are coming out with a lot of programs that would be affordable and that should help you. And you can take the programs from anywhere in the world, from the top naturopathic doctors and experts. Thank you so much for watching us, and let us know your feedback. Bye-bye.
Great.